Beetroot during pregnancy. Benefits, risks, and recipes for pregnant women. In this video, we will discuss. Pregnancy is a special time when taking care of your diet becomes more important than ever. One vegetable that stands out during pregnancy is beetroot. Is beetroot safe during pregnancy? Absolutely. Beetroot is a nutritious vegetable that can safely be part of your pregnancy diet. Its unique blend of vitamins and minerals makes it a great choice. Benefits of consuming beetroot during pregnancy. 1. Beetroot is packed with antioxidants that can help strengthen your immune system during pregnancy. 2. Beetroot's calcium and silica content help maintain strong bones and teeth, lowering the risk of osteoporosis. 3. It is rich in potassium, which helps regulate metabolism and maintain balanced electrolyte levels. Hope this content is helpful for you till now. Subscribe and hit the bell icon for more such pregnancy-related videos. Please continue watching. 4. The anti-inflammatory compound betaine found in beetroot helps reduce swelling, pain, and inflammation in joints, making it easier for pregnant women to stay active and comfortable. 5. With its low glycemic index, beetroot takes longer to convert into glucose, making it an excellent choice for maintaining stable blood sugar levels during pregnancy. 6. Beetroot is rich in folic acid, a vital nutrient that supports the development of your baby's brain and spinal cord and reduces the risk of neural tube defects. 7. Iron deficiency is common in pregnancy, but beetroot, rich in iron, can help combat anemia, reducing symptoms like fatigue and weakness. Risks of consuming beetroot in pregnancy. 1. Overeating beetroot can lead to gastrointestinal issues like nausea or diarrhea. 2. Beets' high nitrate content can cause fatigue, and due to their oxalate levels, beetroot consumption can lead to kidney stones in rare cases. 3. Beechuria, a harmless condition where urine or stools turn red, can occur after consuming beetroot. While this isn't dangerous, it can be alarming. How to safely include beetroot in your diet. Beetroot juice. Ingredients. 1 to 2 raw or boiled beetroot, cut into small pieces. 2. 1-inch grated ginger. 3. 1 teaspoon lemon juice. 4. Water as needed. Method. 1. Add beetroot, ginger, and water in a blender and blend until smooth. 2. Strain the mixture into a glass. 3. Add lemon juice, stir, and enjoy. Beetroot halwa. Ingredients. 1. 2 medium-sized beetroots, peeled and grated. 2. 1 teaspoon oil. 3. 1/2 cup plus 1/4 cup water. 4. 2 teaspoon cornstarch. 5. 1/2 cup sugar. 6. 1/8 teaspoon cardamom powder. 7. Salt. 8. Chopped nuts. Method. 1. Sauté grated beetroot in oil for about 3 minutes. 2. Add 1/2 cups of water and a pinch of salt. Cook until the beetroot softens. 3. Dissolve cornstarch in 1/4 cup water and mix it into the cooked beetroot. 4. Add sugar and cardamom powder and cook for 5 more minutes. 5. Garnish with nuts and serve warm. Beetroot is an excellent addition to your pregnancy diet, packed with benefits for you and your baby. Always consult your doctor before making any major dietary changes.